specific medical problems that it's associated with. And so, in light of the pandemic that we've all been dealing with over the last couple of years, one of the biggest issues that presents is inflammation of the heart, which is myocarditis, or the sac around the heart, which is termed pericarditis. Pericarditis can cause problems because the inflammation of this sac, this pericardial sac, which is fibrous and not really elastic and doesn't really move, is when inflammation happens, fluid accumulates. And because this sac, the pericardium, is so thick and so unable to be distended, that can lead to actual compression of the heart muscle itself. That can lead to blood pressure dropping, and it can cause all kinds of issues with blood flow to the other organs of the body, including the risk of death. And so the pericardium is something that you very rarely think about, except when you have to think about it. And the issue with it, as I had mentioned, and if you have any issues with it, it can really lead to compromise of the rest of the circulation. The majority of people who are having symptoms of inflammation of the pericardium will report chest pain. And that chest pain is characteristically a little bit worse when they're sitting up, and a little bit better, or excuse me, a little bit worse when they're lying down, and a little bit better when they're sitting up. But everyone's going to be a little bit different with regards to that. But going inside the pericardium, we get to the heart muscle itself. And as a cardiologist, one of the things that I deal with sort of the most on a day-to-day basis is blood flow to the heart, the coronary arteries in particular. And so coronary is just the root that refers to the heart, and arteries are going to be blood vessels that bring blood from the heart to other tissues. And so arteries bringing blood to the heart itself are called the coronary arteries. And so when you hear the term heart disease or coronary artery disease, or atherosclerosis or hardening of the arteries, what that really refers to is a problem with the blood vessels around the heart. And those blood vessels are these red structures right here. And so there's three major coronary arteries that I'm thinking about in practice. The first one is right here, which is the right coronary artery, also known as the RCA. The right coronary artery comes off of the aorta right here, and it travels to the right side of the heart and then to the underneath part of the heart, where it gives off a blood vessel called the posterior descending artery, or PDA. And that supplies the underside of the heart, or the inferior part of the heart wall. And the right coronary artery also gives off these branches called the RV marginal branches that are coming off sort of throughout the flow. But the most important thing that the right coronary artery is doing is giving off that posterior descending artery and bringing blood to the underside of the heart, also known as the inferior portion of the heart muscle. The next blood vessel that I'm dealing with is the left main coronary artery. It can be a little bit tough to see, but what I'm going to do is sort of draw your attention to the little structure in there. And so you see there's this little flap right here that's sitting over the rest of the blood vessels, and it's almost obscuring the blood flow. That's called the left atrial appendage, which we'll talk about in a little bit more detail later on when we get into the individual chambers of the heart. But the left atrial appendage sort of obscures the most important artery in the heart, which is the left main coronary artery. And so if everybody can sort of follow where this arrow is going, inside underneath that left atrial appendage, that gets into the left main coronary artery, which will go all the way into the aorta, which is the big blood vessel that is coming off of the heart and giving blood everywhere else in the body. The left main coronary artery gives off two major branches. First branch is this one that goes down the front of the heart. And so if we remember where the heart is sitting in the body, we're sitting head on. And so where that's pointing to is really the front of the heart, which is a structure called the right ventricle. But the left anterior descending artery right here gives blood going down the front of the heart, and it will give off branches towards both sides. The branches that go towards the right, which are here, are called the septal perforators. And those septal perforating arteries supply a huge amount of the electrical tissue of the heart. And so a blockage to that blood supply can cause a widening of some of the electrical signals on an EKG. The other major branches off of the left anterior descending artery, or the LAD, are these, which are going to the left side of the heart, and those are called the diagonal branches. You may have heard the left main coronary artery colloquially referred to as the widowmaker. And the reason that it's called that is because the left anterior descending artery actually supplies 50% of the blood flow to the whole heart muscle. And so a problem with that left anterior descending artery's blood flow has real potential to cause major damage to the heart. And so it's one of the arteries that we really think most about and we're most worried about with respect to development of blockages through the process of hardening of the arteries or atherosclerosis. The other branch of the left main coronary artery is this one here called the circumflex artery. And so let me just get my brush here. So the circumflex artery is this red branch right there. And if you look back to the front of the heart, and then we go again towards that left main, right under that left atrial appendage, what you see with the circumflex is it's actually traveling around the back of the heart. And what that means is that it's supplying blood flow to an area that is really, really tough to see from the surface. And so when you're supplying blood to an area that's not really well seen from the front of the heart, that makes it very, very difficult to pick up issues there on an EKG. And as a consequence of that, circumflex problems can be very, very quiet in terms of the EKG abnormalities. And so you really need to have a high index of suspicion for something going on there. The branches off of the circumflex artery are called the obtuse marginals, or OMs, and you can see a couple of them coming off, and there are usually 2 or 3 OMs, and sometimes the OMs themselves are actually a little bit bigger than the circumflex and supply a little bit more tissue than the full circumflex artery. So we have the 3 major coronary arteries coming off of the heart, and again, that's the right coronary artery here, which is going to the inferior or underside of the heart, right here through its branch called the posterior descending artery, or PDA. And then we have coming off of the left main coronary artery, hidden underneath that left atrial appendage, we have the left anterior descending artery, or the LAD, also known as the widowmaker, and we have the circumflex artery coming off, and the circumflex artery going all the way around the back of the heart. And so the coronary arteries are a huge amount of what I deal with on a day-to-day basis. And problems with the coronary arteries build up over a long period of time, often years, if not decades. And if you end up developing blockages or blood clots in those arteries, that's what leads to a heart attack. And so the vast majority of people that I see on a day-to-day basis are dealing with problems in those blood vessels that are brought on by high blood pressure and diabetes and smoking and high cholesterol that's happened over years and years and years. And understanding that anatomy very, very precisely lets you identify the inferior part of the heart, the anterior part of the heart, and the posterior part of the heart through those 3 different arteries. And when you're looking at an EKG, you're able to localize what you think is going on based on which areas of the heart seem to be involved. Moving on from the coronary arteries, I want to get a little bit more into the structure of the different cardiac chambers. So when blood flow comes to the heart, it comes through 2 blood supplies. One is the vena cava right here, which brings blood from the bottom part of the body up towards the heart. The other one is the superior vena cava right here, or SVC, which brings blood from the top of the body back towards the heart. The superior and inferior vena cava drain into a chamber called the right atrium. And the right atrium also has a little appendage or ear, which you can see here. It's located on the front of the heart, not to be confused with the left atrial appendage, which is more in the back of the heart. We're going to get into a little bit of the cross section here right now. And what I'd like to do actually before we even do that is take a look at the right atrium itself. We're going to pull it out from the rest of the heart, and we're going to see the blood flow comes into the right atrium. Right atrium is this tiny, thin-walled structure, and if you look on the inside here, you can really see how thin the walls are and how just sort of soft and pliable that might be. We get into the valve leading out of the right atrium down into the right ventricle. And that's a valve called the tricuspid valve. It's called tricuspid because it has three different cusps, or three different leaflets that are on it. And there's one that's located near the septum, which is called the septal leaflet. There's one near the front of the heart, which is called the anterior leaflet, and then there's one near the back of the heart, which is called the posterior leaflet. A very common type of irregular heartbeat called atrial flutter actually tends to occur through this area right here between where the inferior vena cava comes into the heart and where the tricuspid valve is located. That area is called the cavo-tricuspid isthmus, or CTI. That's a very, very important area when it comes to dealing with people who have irregular heartbeats, because people who are coming in with atrial flutter, which is a fairly common type of irregular heartbeat, will have this area of the heart very, very easily affected. And the reason that matters clinically is if we go back to kind of where the right atrium is and we think about how we would fix a problem there, what we basically do is we put a catheter into one of the blood vessels in the leg. We'd follow that all the way up towards the inferior vena cava, and then we're able to get in just through that inferior vena cava, put that catheter right at the cavo-tricuspid isthmus, and we can use a very precise electrical signal to burn the cavo-tricuspid isthmus through a procedure called an ablation, and that can essentially cure somebody of the irregular heartbeat called atrial flutter. It's an amazingly cool procedure. So put that back, and we can get into the...
One little note to everyone who's watching. If you want to get up close, in case you haven't explored the controls, using the side grip buttons, if you can see how I'm moving here, you can really get up close, and don't worry, you won't be getting in anyone's way. So you can really get up here and look at what Dr. Katz is pointing out.
Okay. And so I'm going to put the heart into cross section right now, because I think that you can really get a great appreciation for a lot of the things that we're talking about when you see the heart in cross section. And so I want to just reorient everybody. And so we had previously looked at the flow of blood and looked at the area of the inferior vena cava draining blood from the bottom of the body, and the superior vena cava draining blood from the top of the body and going into the right atrium. The right atrium then drains blood down into the right ventricle, passing through the tricuspid valve, which is right here. And that tricuspid valve has three leaflets, which you can really see quite well if you're looking at it in cross section right here, where there's one leaflet near this part of the heart called the septum, which is the muscle that separates the right side of the heart from the left side of the heart. And then there are anterior and posterior leaflets. The valves are connected to the heart muscle itself through these little strings. Those strings are called chordae, and then they attach into muscles that connect to the rest of the heart, and those muscles are called papillary muscles. That can be important when thinking about some heart valve problems, but for the most part, I think that we'll kind of move on from what that means clinically. The right ventricle is one of the two major chambers on the bottom part of the heart. The atria are in the top part of the heart. Singular, it means the singular term for the top chambers is atrium, and when it's plural, it's atria. And so we have the right atrium here going into the right ventricle here. The other side of the heart, we have the left atrium, which is in here, going into the left ventricle down here. The right ventricle pumps blood to the lungs, and the left ventricle pumps blood to the rest of the body. The right ventricle is a much thinner walled structure than the left ventricle is. That is important because the right ventricle has to pump against a much lower pressure of blood than the left ventricle does. And so for one of the somewhat common conditions that I'll be treating is something called pulmonary hypertension, which refers to an elevated blood pressure in the lungs. That causes problems because the right ventricle, as you can see right here, is a much thinner walled structure and doesn't have the muscular fortitude to be able to pump against very high pressures. After the blood goes from the right ventricle up into the lungs, it goes through this main pulmonary artery. And again, it's the pulmonary trunk, which you can see labeled right here, is the term for the common pulmonary artery before it branches into a left-sided branch and a right-sided branch. And blood goes from the pulmonary artery into the lungs, where it acquires oxygen. And then it comes back to the heart, and it returns to the back part of the heart, called the left atrium, through the pulmonary veins. You can see there's pulmonary veins on the right side of the body, and there's pulmonary veins on the left side of the body that I'm drawing arrows to now. Those pulmonary veins tend to be the area where another type of irregular heartbeat called atrial fibrillation often starts. And so the procedure to fix atrial fibrillation, or the ablation that's used to treat atrial fibrillation, is focused on the electrical activity around these pulmonary veins and burning that with catheters in order to isolate the pulmonary veins from the rest of the heart electrically. It's a much more complex procedure, isolating these two large structures versus just burning that small cavo-tricuspid isthmus, as we were talking about on the right side of the heart. And going and thinking about that procedure and thinking about the anatomy of how these chambers are all interrelated is very, very helpful when you're counseling patients about how the safety of and the complexity of the different procedures that we would be considering. And so I want to just draw your attention again to where we're located with the left atrium relative to the rest of the body. And so if you go back to this front part of the heart, what you can see is the right ventricle is the most anterior part of the heart, the part of the heart that's most in the front. And then the left atrium, where the blood flow comes back from the lungs, is in the very back of the heart. And so the fact that it's in the back of the heart leads to a lot of complexity when you're trying to take pictures of it non-invasively. It's a very common procedure that we'll do from a cardiology perspective is a test called a transesophageal echocardiogram, where we actually will put a camera into somebody's mouth, bring it all the way down into their esophagus so that we're looking at the left atrium from the back of the heart. And that matters quite a bit when we're thinking about one of the major complications of the irregular heartbeat called atrial fibrillation, which is a blood clot developing in this area called the left atrial appendage, sometimes called the left auricle, which, as you can see, is in the back part of the heart. So if a blood clot is forming there and you want to be able to take pictures of it, taking a picture from the surface of the heart or the front of the chest often doesn't get the resolution that you need. And so looking to the back part of the heart for how you're going to image for blood clots can be of a huge amount of importance. From the left atrium, after the blood returns there from the lungs, we then pass through the mitral valve here before we get into the left ventricle. The mitral valve is a valve that there are so many doctors who have dedicated their careers to understanding well. It looks so simple. There's these two leaflets, an anterior leaflet and a posterior leaflet. But in reality, the complexity of the mitral valve has to do with how it interfaces with the biggest chamber of the heart, the left ventricle. And so you can see the left ventricle right here has these large muscles that attach to cords of the of the mitral valve. And these muscles are called papillary muscles. And the interplay of the muscles with the papillary muscles with the rest of the body of the left ventricle and the cords of the mitral valve, and then the mitral valve structure itself, particularly this ring around it called the mitral valve annulus, leads to a situation where you can have problems with that valve that are related to the valve itself, but you can also have problems with that valve that are related to problems with the left ventricle. And the interplay between the mitral valve and the rest of the heart muscle is incredibly complex. And again, there are people who spend their entire careers just dedicated to understanding the mitral valve, which when we're just looking at it right here, it just looks so simple. It's almost hard to believe that there could be so much complexity with it. Then this chamber here, the left ventricle, is the biggest, the thickest muscle and the strongest chamber of the heart. It's the chamber that pumps blood through this area called the aortic valve into the aorta, which is the big blood vessel leading to the rest of the body. When we're looking at this left ventricle, you can see the muscle is so thick and it's beating so forcefully. We measure how strong the left ventricle is with something called the ejection fraction. When the ejection fraction goes down, that's often a sign of a type of congestive heart failure called heart failure with a reduced ejection fraction, which has a high risk of sudden cardiac death. For patients who have a low ejection fraction, we're putting them on numerous different types of medical treatments, as well as considering devices that are implanted in the heart, like potentially a defibrillator or a special type of pacemaker. And so moving at a cross section. Now, let's see. Moving at a cross section, if I can close this. Having some technical difficulties with closing the cross section. That's okay. We can kind of talk about things remaining in cross section. So when the blood is leaving from the left ventricle and going to the rest of the body, it goes through this valve called the aortic valve. The aortic valve